Hello everyone, welcome to Beginners Corner at Nerds Horizon Online. Today's subject is Nursing Management. Stay tuned for 15 minutes for a grand success. Nursing Management, the most important topics and questions in 15 minutes. Management is an art of getting things done through the efforts of other people. This definition was proposed by, we have the four options: Mary Parker Follett, F.W. Taylor, Peter F. Drucker, James A.F. Stoner. So this is a very important famous definition of management is an art of getting things done through the efforts of other people. This was given by option A, Mary Parker Follett. Number 2. Improving total performance of organization through focusing on functions of the management. This is a concept of which of the following theory of management? We have the options: scientific management, administrative management, bureaucratic management, and the contingency management. And the answer is administrative management focus about the functions of the management. Let's have a quick summary of the theories of management. Theories of three types: classical, neoclassical, and the modern. Classical management theory having three aspects. Number 1, scientific management aspect. Number 2, administrative management. Number 3, bureaucratic management. Neoclassical having two aspects: human relations approach and the behavioral approach. Modern is of two types: system approach and the contingency approach. Now, question number 3. The theory of scientific management was proposed by, here we have the four options: Mary Parker Follett, F.W. Taylor, Peter F. Drucker, and James A.F. Stoner. And the answer is Frederick W. Taylor. Let us go for a quick review of all the theorists in nursing management subject. Frederick W. Taylor is considered as the father of scientific management. Henry Fayol was the person who described the 14 principles of management. Max Weber is considered as the father of bureaucratic management. Remember, these three people are classical theorists. Now, Elton Mayo is the person who have conducted half-thrown experiments. A very important question: Elton Mayo and half-throw experiments. Now, Douglas MacGregor is the person who described theory of X and theory of Y. Frederick Herzberg again is the person who described two-factor theory, that is motivation and hygiene factor theory. All these three people comes under neoclassical theory. Now, total quality management concept was given by W. Edwards Deming, which is plan, do, check, and act. Now, Peter F. Drucker is the person who described MBO, that is management by objective. Number 4, POSDCORB. As the function of management, it was proposed by options: Henry Fayol, F.W. Taylor, L.H. Gulick, and Erwick. And the answer is option C, L.H. Gulick. Now, functions of the management given by Gulick in POSDCORB: P for planning, O for organizing, S for staffing, D for directing, CO, that is coordination, R for reporting, and B for the budgeting. Leadership, empowerment, and delegation. These are part of which level of management? We have the options: top level, middle level, low level, and all of these. Answer is yes, option A, top level. Quick review of the levels of management. Top level managers are involved with intellectual skills such as leadership, empowerment, and delegation. However, the middle level managers are involved with human skills such as coordination of the all managerial activities between top and the low level. And the low level managers are involved with technical skills such as ensuring the quality service and the supervision of subordinates. Question number 6. Directing includes all except. We have the options motivation, leadership, communication and controlling. And the answer is option B, controlling. Directing is a part of POSDCORB as a function of management, which includes motivation, leadership, communication and supervision. We can remember this by MLC. Yes, M for motivation, L for leadership, C for communication and S for supervision. Question number 7. Which of the following principle of management proposes that organizational controls can be achieved through vertical communication from highest to lowest authority? We have the options unity of command, unity of direction, scalar chain and equity. So these are the 4 principles, and the question is which principle is talking about vertical communication is important to control an organization, and the answer is option C, scalar chain. Have a quick review of the principles. Unity of command, talking about orders should receive from one superior to avoid confusion, such as dual command always make confusions. Unity of direction, talking about single plan and similar activities are essential to achieve a common objective. Simply, a common objective is needed for the achievement of an organization. Our chain is talking about vertical communication, not the horizontal communication is needed to control. Now equity, talk about justice and the protection of the individual rights is essential for the proper functioning of an organization. Question number 8. All are true about strategic planning except. We have the options involved at top management level. Short-term planning includes development of philosophies and policies, involves planning and forecasting. Here we have the question all are true regarding strategic planning except, and the answer is short-term planning. So majorly examination point of view, we need to remember 2 types of planning, strategic planning and the operational planning. Strategic planning always takes at the top level and operational planning takes place at the middle and the low level of management. Now always strategic planning takes a long time, more than 5 years, and short term it is in operational planning usually less than 1 year. Now majorly development of philosophies, policies and procedures, these are the top level managers activity comes under strategic planning, whereas routine working management plans are a part of operational planning. Question number 9. Which of the following is true regarding mission statement in planning hierarchy? We have the options. It describes image of desired future. It describes the present state of organization. It reflects the ethics and values of organization. It reflects the ultimate end results of organization. Question is which is true regarding mission statement, and the answer is option B, which describes mission is always talks about the present state of organization, whereas vision always talks about the future, ethics, values and ultimate end results of organization. 10. A planning method used to track the project schedule and helps in monitoring progress of a project. We have the 4 planning methods. These are Gantt chart, PERT, the program evaluation review technique, and the CPM, that is the critical pathway method, and the 4th one is Q-sort technique. The question is in which of the following technique is used helpful in monitoring the progress of a project, and the answer is option A, Gantt chart. Question number 11. The best patient assignment method applicable in ICU's setting. We have the options: case method, functional method, primary nursing method, and the team method of nursing. And the answer is option A, case method. The patient assignment methods, the major ones. Number one, the case method, talking about 1:1 care. Yes, of course, it is suitable in ICUs and teaching nursing students. Now, functional method, it is talking about task focused method, especially applicable in emergency situations. Now, the primary nursing method, talking about 24-hour responsibility and the accountability of total patient care by a primary nurse from admission to discharge. Now, the team nursing, talking about comprehensive care with a group of healthcare workers. So we have the one. Most important one is primary nursing and the case method. Case method is the oldest method also. Question number 12. Which of the following is not a general approach for a quality assurance program? And we have the four options: accreditation, licensure, certification, and audit. Question is, among these four, one is not a general approach for quality assurance program, and the answer is option D, audit. Distinction between general and specific approaches in quality assurance program. Generally, credentialing, licensure, accreditation, and certification are used for assuring the quality. However, in specific approaches, audit, peer review, patient satisfaction survey, incident, critical review methods are used. Question number 13. Which of the following is a comprehensive method of performance appraisal? And we have the options: essay appraisal, rating scale, confidential report, and 360-degree approach. Among these four, which one is a comprehensive method? All these four are part of performance appraisal. And the answer is 360-degree approach. Question number 14, one of the very important question in nursing management, that is related to inventory control. And the question is, which of the following inventory control method is based on annual consumption value of items? We have the four options: ABC analysis, VAID analysis, FSN analysis, and HML analysis. Question is, annual consumption value of item is based on which of the following inventory control method? And the answer is option A, ABC analysis. Now, let us go for a quick summary of inventory control techniques and the methods. ABC talks about always better control, in which it is based on annual consumption value and cost criteria of the items. Worth analysis, it is vital, essential, desirable analysis. It is based on the criticality and the shortage of items. FSN, fast, slow, and non-moving analysis, is based on the rate and speed of consumption. HML analysis is based on unit cost of items. SDE analysis is based on market availability. In this topic, the most important questions are three: ABC, VAID, and FSN. So let us discuss with some code views. VAID is talking about vital. So it is based on criticality and shortage of the items. FSN talking about fast, slow, something speed. So rate and speed of consumption is based on FSN. Now ABC, always better control, always A, and we can correlate with annual, A to annual consumption value of the items. To the last question of the day, that is, the philosophy, policy, and purpose of the institution are part of which of the following staff development program? All the four options are part of staff development program, and the question is, philosophy, policy, and purpose are discussed in which of the following programs? induction training, job orientation, in-service education, and the continuous education? And the answer is induction training, which is a part of training in staff development program, which is done in the first 3 days of training. Check our playlist and prepare accordingly as per your lacuna and need. Thanks for the kind attention. Your comments are highly appreciated. Have a good day.